Televisa presenta
Lo que se viene a continuación. En MP3. En MP3.
Hi, my name is Romina, and in the video I play the role of a patient. Today we will present a representation about intensive care nursing in patients with COVID-19. My team is made up of Ana Martinez as a doctor, Dan Escamilla as the patient's family, and Kevin Hernandez as a nurse.
Hi Armina, how are you? I'm your nurse this day. I need to check your vital signs, okay? Yeah? Okay. Don't worry, Romina. Give me 1 second. Hi, Doctora Ana Lilia. Is the 10 p.m. She Romina Munoz. She has 55 years with a significant medical history. She has hypertension and diabetes type 2. Also, she has a history with the smoking.
Hello, nice to meet you. I am Dr. Ana Martinez. I want to inform you that nasal secretion sample was taken from the patient and sent to the laboratory for rapid analysis. The tests come out positive. Therefore, unfortunately, the diagnosis of coronavirus is confirmed. Sorry. Coronavirus can cause shortness of breath or pneumonia. Medical problems a person is early facing can get worse, such as hypertension and type 2 diabetes. Complications of severe coronavirus illness can include acute respiratory distress syndrome when the body's organs don't get enough oxygen.
Treatment and monitoring in the ICU for patients with COVID-19. Mechanical ventilators are devices used to help patients breathe when they cannot effectively do so on their own. It's used common in intensive care units and emergency situations. Continuation positive airway pressure is a treatment that machine uses to help keep the airways open while you sleep. It is used to treat sleep-related respiration disorders such as sleep apnea. Extracorporeal membrane oxygenation is used in intensive care of help a patient's heart and lungs recover. It's used when patient organs do not work of their own and is considered as last option when other treatments have to be effective. Configuration and using a mechanical ventilation for patients with COVID-19 involving several critical steps considering the specific characteristics of the diseases and the patient's needs. It's essential that the configuration that uses the mechanical ventilation be carried out by trained personnel following the guidelines and protocols established for the management of patients with COVID-19. Among other things, the use of personal protective equipment is essential for nursing staff to protect themselves for infection and disease. For example, proper of gloves, mask, and respiration, aid protection, and others.
As nursing intervention, it is essential to measure and record the patient vital signs, temperature, respiratory rate, oxygen saturation, blood pressure, heart rate and pain, more important. And oxygen therapy is started if saturation falls below 92% on room air. Advise the patient to sleep is in the prone position whenever possible. And in the treatment plan is suggests a regimen for dexamethasone 10 milligrams for 5 days in patients with acute respiratory distress syndrome and use high flow oxygen therapy. As the next step are the conventional oxygen therapy. Invasive mechanical ventilation should be intensivos wide and dial. Volume of 4 to 6 milligrams per kilometer or anticipate wave. Okay, thank you.
Hi, doctora. The patient, she need managing of the separation, sectioning techniques, with sectioning techniques, providing through skin care to prevent ulcers, and implement strict aseptic measure to prevent secondary infections. It's all.
Nursing is important in managing the complexity of the coronavirus case since it is responsible for providing care through which it promotes, preserves, and restores the health of the patients under its care. Just like doctors, since they seek to cure diseases and restore the patient's state of well-being and functional normality.
In COVID-19 care in intensive care units, the challenges are considerable. One of the main problems is the scarcity of resources, ventilators, personal protective equipment, and other critical supplies are not always available in the quantities needed, which can complete management of the most seriously ill patients. In addition, nursing staff face a high workload, with an increase in patient numbers, shift length and pressure intensifies, affecting the quality of care and the well-being of the team. Another crucial challenge is emotional stress. The constant suffering and high mortality rate generate great psychological pressures. Staff must cope with grief over the loss of patients and fear for their own health, all while maintaining high level of performance under extreme conditions. This challenge highlights the importance of strengthening support and resources for healthcare professionals in times of crisis. Fatal.
I'm sorry, doctor. The patient that at 3 a.m. He had a respiratory complication. We called to anything. I'm sorry.
Family of patient Romina,
Yes, what happened?
I regret to inform you that patient Romina has died from a respiratory complication due to the coronavirus and her previous illness.
What? How is possible? It's possible. It was high fat because of lack of recourse.
I am sorry. As I told you, your daughter had respiratory complication with everything in
What is
our
possible?
power.
What is
With great sadness, I want to share with you that I have lost my family member due to a series of devastating events that occurred in the hospital. Unfortunately, the medical care he received was inadequate and insufficient, which although not have the supplies or the necessary material to carry out the correct treatment of the illness, which led to serious complications and finally to his death. I feel frustrated by the lack of care and responsibility that the hospital showed. The loss of my loved one irreparable, and the feeling that this could have been avoided if they only had the necessary supplies. I want to guide for justice and transparency in this situation and hope the measures we have taken to ensure that something like this does not happen again in the future. My family and deserves and were the shame in the system prevent more unnecessary losses.
Yo te extrañaré, tenlo por seguro.